Our next guests are board-certified emergency room physicians. They weren't happy with those typical first aid kits that you would pick up at the drugstore or whatnot for your children, so they said, we're going to take matters into our own hands. We're going to do this right. So they created their own baby stat and kid stat. Please welcome two of the three mommy doctors who are responsible for this, Dr. Mizuho, am I getting it right? Spanger and Dr. Veronica Vasquez. Welcome, ladies, for being. How did you guys connect? Were you in the same ER together? Or?
We actually, there's three of us. Our third partner couldn't make it today, but we all met in residency. We trained as ER physicians together at LA County USC Medical Center. And we stayed very close friends throughout residency and thereafter. We now have 7 children between all three of us, and 1 more on the way.
Oh,
so we know a thing or two about taking care of kids and being physicians ourselves. We just realized we were getting hit up a lot by friends and family about medical emergencies, about different types of injuries. My kid is sick. We're getting calls in the middle of the night, texts. And we realized that the kits that were out there were really lacking in some of the things that we use in the ER. And on our own kids, you know, we have our own little kits that we had at home. And so we decided we need to really bring these to families so that they can provide the same type of care to their kids.
All right, well, let's start with the kids kit first. And I know Debbie and Orly are particularly interested in this. And tell us what we can find in here.
So we wanted to organize KidStat. This is for any mobile child. So the minute your kid starts up and walking, this is when you need this. And it addresses the 3 most common pediatric injuries. So cuts and scrapes, aches and sprains, and bites and burns.
Are you seeing what this, ladies?
So it's
because when you
compartmentalized.
open it, you immediately know, oh, my child has a cut or a scrape. You know exactly where to go within this kit to get what you need. So part
of what we're doing is trying to keep it organized for you so that in that moment of panic, you know where to go. And then when you open it up on the inside of the case, you actually see the instructions, which give you, first stop is the red flags. So if you meet any of those criteria, you need to go straight to the emergency room. I don't want you rummaging through the rest of the kit. If you pass go, then there's actual step-by-step instructions on how to use everything that's inside.
Which is all inside of here.
Are stitches included? I'm kidding.
That's an emergency room. Yeah.
If you come to our house, maybe.
I know, you can actually give them stitches, right? Okay.
What are some of the main concerns we have for a child at this point when we open it up and we look in there?
You know, I think that if you look at, say, like cuts and scrapes, I think one of the biggest concerns or questions that parents have is their kid falls and they get a cut. How do I know if they need stitches or bleeding, and like, what do I do? You know, a lot of times the first aid kits have a lot of those alcohol swabs on there or pads. You should never use those on a wound.
Really?
And every kit is packed with those. And so,
oops.
You know, we teach you just to irrigate it under room temperature water and hold pressure so that it stops bleeding. And then if it's deep or if it looks contaminated or dirty, then you need to come to the ER. The other kind of what we call the golden window of closure is that really wounds should be closed under 8 hours. And so if you come to us after 8 hours to 12 hours, you're really narrowing the risk of us.
I think people get really distressed by that because they come the next day. You can imagine if it's on the face, something comes and we say, well, you can't close that now because it's at risk of getting infected. It's really disheartening to parents, and you feel bad.
And it's going to be a
You feel like you missed a fracture. Or you missed.
Rub it in. Rub it in.
You don't want to be that like crazy helicopter parent that's taking them and rushing them to the hospital and like all over it for something minor, and then the back of your mind you're thinking, but what if?
What if?
And so it's that information is like gold right there.
And no parent wants to Google, right? No one wants to Google when you're.
Well, as soon as you Google, everything bad comes up. It's not a good idea.
There's like bites in particular, like spider bites or a snake bite, whatever. How do you know when to bring the child in?
So that's a really good question.
Poisonous.
Yeah. So bites and burns is another compartment in there, and again, we address sort of the allergic reaction or anaphylaxis if you're to get like a bee sting. So we provide the tweezers in there. No, there's no EpiPen because that isn't really safe for all kids. But at least it tells you when you need to go with a bite. More importantly is the burn section. One of my favorite things in the burn is this item that you can't get anywhere else. So this is saline dressing. So unlike adults, when kids get burned, every pediatric burn needs to be seen by a physician. And there's certain burns that really need to come to the emergency room.
Why?
The reason is because kids are growing, obviously, and so certain areas of their body, so their over joints on their face can scar down and actually delay growth over certain areas. Yeah. So whereas you and I get burned, you throw a little Neosporin on it, you move on with your day. kids, we've seen everything, mayonnaise, butter. Don't put anything on it. A saline dressing or even just a wet towel, just so you don't trap it.
And never ice. Don't
Never
ice.
No?
Yeah, just again, room temperature water and head
Do you
to
dress
the
it with
emergency
anything? If you don't have,
if you don't have this,
that,
then I would just honestly run it under tap water and then don't put anything on it. Just come in.
Or just buy this.
Yeah, exactly.
Just make life easy.
Yeah.
Let's go on to the baby stat. So this is where they're mobile, you said, right? If they're not, Dr.
So
Veronica.
this is really geared for a baby's first year. So I'll be the first to admit, I'm a doctor. Everyone assumed that I would know what to do. I was terrified. I had no idea.
Like every mom, right?
Yeah.
And yeah, it's terrifying. This person is coming home with you.
Yeah.
It's yours. And so this really is about, it's separated into categories again, but it's really about keeping things simple. So you have ouchy, yucky, cranky. And while it's cute, it's also functional. So one of the biggest things that people get concerned about with babies is, are they breathing okay? And when kids get sick, it can be really, really scary. Obviously, we have our red flags. So if the child is breathing way too fast, if they're making funny noises, they're grunting, they're wheezing, something is not right. If there's any color change at all, any blueness around their mouth, in their hands, you got to go to the ER. Okay, this is not the kit. Leave the kit and run, because we really need to assess that child and make sure they're breathing okay. That's not happening. There are a lot of things that you can do at home. Now, as you can imagine, if babies are obligate nose breathers, and that means that they breathe primarily through their nose. So if they're trying to choose between bottle feeding or breastfeeding and they can't breathe, they're going to choose to breathe. So they're not going to want to eat. So we get a lot of parents coming in the middle of the night saying, my baby doesn't want to drink anything. He's not taking the breast, he's not taking the bottle, and it's really stressful. And so one of the things in here that's really helpful that I really love is this. And it's the nasal bulb suction. Okay, and this is used in NICUs everywhere, used in the hospital like gold. And if you forget it, or if you don't realize when you leave the hospital that that's what you need, it's like panic time. Where is the nasal bulb? Right. And we tell you how to do it, how to appropriately suction the baby so they can breathe okay and they can continue to eat, and you can go about your business.
Yeah, we had one thing in my first aid kit growing up, and that was cow salve, if you know what that is, and that's healed everything. That's all we had.
That's actually so good.
But, yeah, it is. It's really good, but that's all we had. Now I look at cranky and ouchy and yucky, and I'm thinking we've got Snow White and the Seven Dwarfs down here. What happens though? Where's fever fall under this category for a child?
So that's under ouchy. So fever is a big topic for parents, and it's again another scary thing.
It is.
Yeah.
They're on fire. What do I do?
Gosh.
What does that mean? Do I need to go to the hospital? Do I not?
What temperature do you bring your child into the hospital?
That is a big thing, and the temperature of over 100.4 in an infant rectally in somebody who is 0 to 3 months is a medical emergency. And I think a lot of parents don't recognize that. No. And the reason for that is that babies at that age in the newborn period are very susceptible to serious bacterial illnesses. So it can spread in their bloodstream.
Good God.
And you can't tell, right? Baby, you can't really...
I mean, how are we alive on this planet? It's so dangerous.
But it's one of those things that, we as ER physicians, we know that. It's a no-brainer. You come in. We want you coming to the ER. We don't want you given, any anti-fever medicine. Come in so we can assess them. Now, the most appropriate way and most accurate way to take a temperature in a baby is rectally. And for some people, it's like, well, I'm going to stick a temperature where?
Yeah.
But we tell you in our kit how to do that. We provide a rectal thermometer. We give lubricant so you can know how to do it, and we give you the guidelines in terms of where the fever, what type of fever, and head to the emergency room.